If you have experienced one miscarriage or more than one, you may have been left with the same question. Should I be doing tests? Is there anything wrong with my body? Or was this just bad luck? I'm Dr. Lily from GinSen, and in our clinic in London, we support people through fertility journey and recovery after pregnancy loss, using Chinese medicine alongside evidence-informed care. In the last video, we talked about 8 different types of miscarriage and what they mean medically. In this video, we are focusing on what comes next when miscarriage is something doctors take a close look at. What kind of check usually makes sense and which one don't, and how to support your body after loss, whether you are planning to try again or simply try to recover. This is not about rushing forward, it's about giving your body and your experience that clarity and care they deserve. Recurrent miscarriage definition. Now let's talk about why this definition shift usually matter in real life. Because when the medical system decides what counts, it directly affects access to care. It can determine whether you are offered or refer to a specialist blood test or imagine close monitor in a future pregnancy. And just importantly, validation. And that validation matters more than most people realize. A biochemical loss can look like just a later period on paper, but emotionally, it can represent a pregnancy you hope for, planning for, and had already begun to imagine a future along. So when someone asks, does it ever count? The answer is not just medical. It counts because it happened, and it counts because your body went through a real biological process, hormonal shifts, change in the uterine lining, and then loss. From a Chinese medicine perspective, this is also why we don't treat pregnancy loss as a signal label. We look at patterns such as how well the body is able to hold, nourish a pregnancy in the early stages, how smoothly someone recovers physically and emotionally after loss, whether the menstrual cycle return regularly or become disrupted, and whether there are signs of depression, coldness, stagnation, or lightening stress afterwards. Because recurrent loss is rarely about one isolated fact. More often, it's a combination of timing, embryo development, and the body's overall internal environment recovery capacity. And this is where a structured, personalized approach becomes far more valuable and then argued reassurance. At GinSen, this is exactly how we work through individually consultation that look at your full history, your cycle, your recovery after loss, and a currently body state. So support can be tailored to you, not just a diagnosis on paper. If you'd like to explore the personalized assessment or understand what support might be appropriate in your situation, you can find more information through the link in the description. Most common cause of miscarriage and hope for future pregnancy. Now let's address the question almost everyone asked after a loss. What did this happen? The most common cause of miscarriage, especially early miscarriage, is a chromosome or genetic issue within the embryo itself. And what I want to be very clear of what about that meaning. In TCM, it doesn't mean there is something permanently wrong with your body. It means that in specific pregnancy, some things went wrong very early in development. Often this happens during first stages of cell division. Some things even before you know you are pregnant. It's not the result of one moment, one stressful week, or one single mistake. It's a process that are beginning at the level of the embryo, not a failure of your body to carry a pregnancy. And as hard as that truth is, it can also bring a certain kind of relief, because it often means it wasn't something you could have prevented, and it hasn't necessarily a permanent condition of your body. Now, evaluation can still be important, especially after 2 or more losses. Clinics maybe look at things like genetic factor, uterine structure, thyroid and hormone balance, clotting, tenderness, immune-related factor in certain cases, and your full clinical history to see if anything standing out, but it's all to know something that can be deeply frustrating, even after a fully workup. In a significant portion of cases, often described as round half, no signal clear cause is identified. That doesn't mean your loss wasn't real. It means medicine doesn't always give any answer. And this is where I want to introduce a very grounded way to think about hope. Hope is not pretending the loss doesn't happen. Hope is understanding that one loss, even more than one loss, doesn't automatically predict the future. Many people go on to have healthy pregnancy after miscarriage, even after repeated loss. So, if your mind keeps saying there must be something wrong with me, I want you to pause and consider a more accurate statement. Some things went wrong in that pregnancy. That does not mean your body is incapable of carrying a pregnancy. And for a TCM perspective, that is why we focus on so much on recovery and internal stability, not as a guarantee, but as a way of getting the body best possible condition for the next attempt. That may mean rebuilding blood energy after bleeding and hormone supporting the kidney system and reserve, especially if you feel depleted, calming the stress response so the body can shift out of survival mode and ensuring digestion and nourishment are strong enough to support early development. Not because you caused the miscarriage, because your body deserves support after a loss. Additional resource on miscarriage. Next steps. Practical and calm. If you made it this far, I want to acknowledge something, which a video like this is not a casual content. People usually look at for this information because they are living it. So here are some next steps depending on where you are right now. 1. If you're recurrently going through a miscarriage, ask your clinician which type, then believe this is what evidence support. That's ultrasound finding, hormone trending, symptoms, what you should expect physically over the next day, and what you should think urgent care. And please remember, if you develop a fever, severe pain, full smelling discharge, or feel severe, serious, unwell, think urgent medical attention like GinSen provide. If you have 2 or more loss, ask for structured review, because you deserve a thoughtful plan rather than vague reassurance. That review maybe include uterine imaging, thyroid and metalis check, clotting and autoimmune screen when appropriate, and fully look at your timeline and history. If you are emotionally struggling, please do not wait till you are strong enough to ask for help. Grief is not something you power through. Support is part of care. And if you are in that complicated space, whether you are grieving but also thinking about trying again, that is normal. Most people could have the same feeling. You have allowed to hold both grief for what happened and hope for what comes next. Those two realities can be coexist. If you want a supportive recovery planning, this is where the integrated care can be helpful. At GinSen, we support recovery through acupuncture to support circulation and nervous system regulation, herbal medicine based on your pattern and timing, and practical nutrition and lifestyle guidance that helps the body rebuild after loss. And if you are not in London, or online consultation and also products are available worldwide. But the principle is the same. Recover deserves a planning, not just a time. Conclusion. Let's bring this back to the proposal of today's video. Miscarriage is one word, but many experience. Understanding the type of miscarriage you had can help you understand what was happening in your body, what follow-up might be appropriate, and what question to ask next. If you remember nothing else, remember this. Miscarriage is not your fault. Most miscarriages, especially early ones, are caused by embryo developer issues that I did not create, and even after more than one loss, it is still medically reasonable to hope for a healthy pregnancy in the future. If you're watching this because this is personal, I'm truly sorry for your loss. You deserve clarity, you deserve support, and you deserve care that treat your experience as real. Because that, you can fill it online consultation form. GinSen expert can help you.